Hi, hello everybody. Welcome back to another session of One Question a Day. The question that we are going to see about today is the anatomy of capsule and structures and the nerve supply associated with parotid glands. Very often repeated amalgamation of anatomy and oral histology questions. Start with this diagram. A face where the parotid gland is situated, mark it. The face should be little bit neat. Okay, the parotid gland is an exocrine gland, meaning duct is present. This is the first point you write, and it is a tubulo-acinar, has tubules and acinar. The gross anatomy shape, it is an inverted pyramidal shaped gland with the base facing upwards and apex facing downwards. Weight is about 14 to 28 grams, height is about 5.8 centimeters, width is about 3.5 centimeters. When writing this, I would prefer you to give a range like this rather than this accurate numbers. Location, the gland has distinct two parts, the superficial part and the deeper part. The superficial part is situated below the external auditory meatus, whereas the deep part is behind the ramus of mandible in the retromandibular fossa. Borders and surfaces, it has got four surfaces: the superficial surface, anteromedial surface, posteromedial surface, and the superior surface, which forms the base, with three borders: anterior border, posterior border, and the medial border. The relations, the apex is very close to the cervical branch of the facial nerve and has the retromandibular nerve passing through near to it. The base is along the temporomandibular joint. Anteriorly, it is guided by the masseter muscles and the ramus of the mandible. Posteriorly, lined by the mastoid process and the styloid process inferiorly, posterior-inferiorly. Capsule. The capsule of the parotid gland is covered by an investing layer of deep fascia, which has two laminas, superficial lamina and deep lamina. Superficial lamina is thick and is called as the parotidomassetic fascia. The deep lamina is a thin layer and is guided by the stylomandibular ligament. The duct of the parotid gland, major collecting duct that pours outside, is the Stenson duct, which is about 4 to 6 centimeter in length and 5 millimeter in diameter. The duct is present along the ascents or passes along the anterior border of the gland, crosses the masseter muscles, pierces the buccal pad of ant, the buccopharyngeal fascia, buccal mucosa, and the buccinate muscle, and accompanies the buccal branch of facial nerve. The duct opens at the vestibule opposite to the crown of the upper second molar or the maxillary second molar on either sides. The blood supply, the major blood supply to the parotid is the external carotid artery and its branches, namely the maxillary artery, superficial temporal artery, transverse facial artery. All this applies to the parotid. Vein is the retromandibular vein with its anterior and posterior divisions draining the parotid glands. Lymphatics. The lymphatics is from the paraparotid, intraparotid, superficial lymph nodes, and the deep cervical lymph nodes. Nerve supply, it has got both sympathetic and parasympathetic. Parasympathetic starts from the inferior salivatory nucleus, passes via the glossopharyngeal nerve through the tympanic branch and the tympanic plexus, after which it rides through the lesser pterosal nerve, relay in the otic ganglion. The postganglionic fibers jump through the or pass through the auriculotemporal nerve to reach the parotid gland. The sympathetic at the T1 spinal cord, lateral horn, the postganglionic fibers of the superior cervical ganglion passes to the parotid gland. Histology, the parotid gland is a pure serous salivary gland, though infants have some mucus cells. Outermost connective tissue, capsules dividing the entire content into septas, lobes with fat bodies. Invagination of the capsule called septa forms numerous lobes. Lobe contains uniformly placed acinar cells or the serous acinar cells. All acinars are identical and they are pyramidal in shape with the apex facing the lumen. The apex has zymogen granules or the secretory granules which have a dense core and situated very near to the lumens. The protein secretory component is the vesicles, Golgi apparatus, rough endoplasmic reticulum. Intercalated ducts are profusely branched. The nucleus is very close to the basement membrane. The striated ducts are pale colored, whereas the intercalated ducts, which are profusely branched, are present in numerous. Clinical significance: inflammation of parotid glands can cause what a condition called as viral infection called as mumps. That we come to the end of the discussion on the overall anatomy, capsule, structures, and nerve supply of parotid glands. This is how you attempt and balance within the 20 minutes time limit that is provided for a essay. Happy learning. Learn incrementally, at least one question a day. Till we meet again, happy learning.